how things changed for you and what that meant for you.
Well, as the impact of the pandemic came out, I think a lot of it had to do with just uncharted territory for a lot of folks. I mean, we deal with illness and disease all the time, and it's what we do. But to have something of that scope come on all at once, lots of conflicting information about what was going on, and try to decide what the best practices were. Things really did slow down, I'd say, to 10 miles an hour for a while when it was just first rolling out and everything was shut down and there were no elective surgeries, which for the most part in orthopedics, it's the bulk of what we do is elective. Now we do see fractures and those kind of things from the emergency room, but in terms of the scope of our practice here, most of it's elective, and so it did take a big toll on not just our ability to work, but also on our patients' ability to get stuff taken care of. And so we were definitely at odds with trying to take care of folks, do the right things, but also balance that against keeping people safe and wading through all the conflicting information and guidelines that we're evolving to try to figure out how to do this safely and ultimately get our mission done, which is to take care of folks, and at least from an orthopedic side of the house, taking care of their musculoskeletal conditions, which for what I do in joint replacement, the bulk of my patients are the high risk patients because they're mostly 60s, 70s, and 80s, and so it was very real for them. And a lot of folks, foregone doing surgeries until things calmed down, which was always an evolving question mark on when that was going to be.
That's what he mentioned this morning, was a lot of people kind of held off on how did that affect things. He said kind of an onslaught of people all of a sudden, coming in to get everything that should have been probably taken care of.
Right. And in terms of the hospital system, really the services that were getting crushed on a daily basis was the hospitalists, the internists, the folks that were actually on the front line taking care of the COVID patients, whereas the rest of us that primarily were in either an elective or other body system mode, a lot of times we were just sitting on our hands, waiting to be told that we could do stuff. It was kind of frustrating because the system is getting so beat up, but we're not bored, but in a sense we have nothing to do, and it was an interesting mismatch of heightened anxiety, but also, come on, when are we going to get on with this?
When we're ready to go.
Right.
How are things changed now? How are things? Are they getting back to normal? I don't want to use that word, but are they getting back to?
Absolutely. I think that the current guidelines that we have, the social distancing, the mask, where I think for good or ill, that's kind of become just how we do things now. It's gradually changing and getting back more towards where it was pre-pandemic, but in terms of the volume of cases, after that first couple months, 6 weeks, 8 weeks, we started to reinitiate a lot of the stuff and things once we got a little bit better handle on our inpatient capacities and we got through some of those peaks and we started to get some wiggle room on getting some other stuff done. The orthopedic side of the house started to pick up again. And we always continued with our non-surgical management, injections, physical therapy, trials of things, all these things that you were normally doing anyway before you ever signed somebody up for surgery. So that ball kept rolling, but actually getting to that surgical decision point was delayed. But after 2 months or so, that began to pick up, and then mostly it was just a question of when were patients comfortable coming back, as opposed to were we able to kind of do these things. A lot of that initially was driven by the PPE, concerns about conserving that for emergencies and not necessarily wasting it on elective cases that could wait. And after we got kind of past that concern, things definitely turned in a more positive direction in terms of getting patients in to take care of their deferred maintenance, that they hadn't done because of the pandemic.
The department itself has has that department gotten stronger over this? Do you guys feel that? I hate to use something like that makes us all stronger.
Correct.
We're looking for something that you might think that has that pulled you all together a little bit closer, things of that nature.
I think so. I think it's definitely emphasized the interaction between services in the hospital. services couldn't be an island unto themselves anymore. Not that they were, but this really forced services to kind of integrate their care, consult with other services, assess and resources. I think it just made us a lot more aware of where we fit into the picture, as opposed to just, ortho's doing their thing, and rheumatology's doing their thing, and medicine is going to do their thing. And so I think that definitely made a difference. And as you had more time on your hands, you got to interact with your colleagues more. So that was a plus, at least from a professional interaction perspective. So, and adversity in almost anything is going to build your calluses and make you a little bit better at what you do. And so if there is a positive to any of this, it is that. I think we've become more efficient, more resilient, and definitely more aware of our sister services through the course of this.
The new surgery, I guess not new, but a few years old. How do you like working in the surgery?
Yeah, it's a beautiful facility here. I mean, just looking around, obviously the aesthetics of it are great, but also the facility is great. And we tend to limit a lot of the surgeries here to the truly outpatient surgeries where people are going to go home the same day. And that does limit me somewhat on the primary things that I do in terms of joint replacements. But we've done some total knees down here, and they've turned out just fine. And obviously we do a lot of outpatient sports medicine type of procedures down here. And it's always it's a true pleasure to work here. It's a pleasure to work in Beloit as well. But it's just a different environment, a little bit of a different vibe down here. It's a great experience. I think for everybody. I think patients really enjoy being able to come here, especially for those on this side of the border. That seems to be a big draw for them. Each facility has its strengths. We got more depth of services, a little broader capabilities in the main hospital, but for the folks that are healthy and are definitely great candidates for a same-day kind of procedure, even for our bigger ones, it's a great facility and a great resource. A double whammy from folks, with my military service, and it's all a lot of service members. I know it's kind of an awkward circumstance when we're thanked for our service, and it's a hard thing to kind of respond to, because I consider my service a privilege, and for somebody to thank me for doing what I chose to do and truly look back as one of the best times of my life and most rewarding times, I almost feel guilty that they're thanking me for something that I'm so thankful for. And the same is kind of true with a lot of the placards and billboards around the hospital with healthcare heroes, and I think of myself, I'm the furthest, I shouldn't say the furthest thing, but I definitely don't consider myself heroic in any sense. I mean, this is what I signed up for. This is what we do. If not to take care of the sick, then why are we here? Now, I absolutely appreciate people's appreciation for what I'm doing, thankful that we're there to do it, but the heroes I encounter on a daily basis, don't wear the clothes that I wear. The heroes that I encounter is the mid-80s husband or wife that's pushing their spouse in the wheelchair, that are using the wheelchair as much to hold themselves up as they are to get them in the exam room, and they're the ones foregoing their hip or knee replacement because they can't take the time because their husband or wife is the one, or the mother of the child that has cerebral palsy that's completely involved in their life, dawn to dusk, and several times in the middle of the night, all revolve around their child that they love so much, and yes, they chose to have him, but that's so far from what they probably thought they were signing up for. And those are the heroes I deal with on a daily basis. And again, I absolutely appreciate the recognition of either my military service or my contribution, but I think the hero label belongs to somebody else.
Very good. Very nice.